Hi, it's Lipstick Gal. Thank you so much for watching today. I've recorded this very video probably 5 times already, and I've never either been able to upload it, edit it. I haven't been wanting to. And let me just say at this point, this is regarding my health. So if that's not of interest to you, this is not a beauty related video, just go ahead and click out. But I feel like I kind of need to put this up to let you know what's going on with me. And part of it is also just saying things out loud is really therapeutic. So I'm sorry, I'm kind of using this situation right now as a little bit of therapy, and I hope that's okay. But thank you so much for watching if you're still watching. So I have mentioned before that I've had a lot of medical problems and I've had a lot of surgery. I've had 13 surgeries. I had a series of 4 of them this fall, like September and October of this year with my gallbladder. It was a bit of a drama. But I've also had 4 brain surgeries. And a lot of my medical issues and dramas stem from something that I deal with in my head. And I have had headache pain for decades. If you suffer from migraine headaches, if you suffer from cluster headaches, if you suffer from ice pick headaches or like anything like that, I want you to know that I understand on a very deep and personal level how frustrating and painful that can be. I was diagnosed at 17 with something called Chiari malformation. And it's a type of malformation where part of my brain, the cerebellum, which is the very bottom part of your brain, right before it meets the spinal cord, is too large for the space inside my head, inside my skull. And what happens is that part of the brain kind of works like a plug, and it gets shoved down into the spinal cord area, down into the vertebrae where it shouldn't be. And then spinal fluid flow is restricted. So spinal fluid is made in some ventricles behind your eyes, and it kind of flows up and around your skull all the way down your spine. And as it comes up the front of your spine, parts of my cerebellum are plugged into and kind of shoved into my spinal cord. Spinal fluid is coming up and it can't go anywhere. So it was turning around and going down and creating cysts in my spine. Now, if those were to rupture or get too big, it could paralyze or kill me. So that's what caused my first Chiari decompression, which came along with the C1 laminectomy and a duroplasty, which means they cut a hole in the covering to my brain, the dura, and they put a patch on there to make it a little bit bigger. They took out a piece of bone, so my brain, instead of being scrunched in like this, had a little place kind of to pop out. And they also did the same thing where they took out a little piece of bone in my cervical 1 vertebrae, so that if the tonsils descended a little bit, those cerebellar tonsils, that part of my brain that was kind of too big, if it went and got down in the spinal cord, it could kind of ease itself out a little bit and I would still have restored spinal fluid flow. So that surgery happened in 2005. And I woke up with the worst headache that never went away. And for the next 12 years, I went to sleep with a headache and woke up with a headache, went to sleep with a headache and woke up with a headache. And the neurosurgeon who did the surgery here in my small town in Washington State, after seeing me for 12 weeks post-surgery, he's like, "You're no longer a surgical patient. I don't do pain management. I'm sorry, I can't help you. Goodbye." I started seeing a specialist in Seattle, which is 5 hours from my house. It's a long drive, but my husband would drive me. This is before we had kids. We'd see a specialist. Sometimes he'd take me to the ER in Seattle because nobody here could really help me. And I didn't really get any pain relief. From that point, in the fall and winter of 2005, I had surgery in June, and then all the way through the fall and winter, I saw a lot of different people. And all the way through 2006, from the first neurosurgeon who did the initial surgery to the last one I saw at the tail end of 2006, I saw 11 different head specialists. And they all said the same thing. One of them said, "The pain you're describing is impossible. You can't possibly have it." He basically told me I was lying. Another one told me, "Well, we've looked at all of your imaging. We've done MRIs, we've done CTs. There's nothing anatomically wrong with you. I don't know why you're having head pain." And some other ones just said, "I see that you've had this surgery done, and sometimes this surgery, instead of making things better, only makes things worse." and hearing from almost a dozen different specialists that either I'm not in pain or I'm just going to have to live with it put me in a terrible headspace. I got a lot of severe depression, and the pain I was dealing with on a scale of 1 to 10 was a 7 or an 8 every single day. And for a long time, I just kind of powered through. I got up and I went to work, and then my husband and I decided to have 2 kids, so I started working part-time, but I was raising kids full-time at home. And 2 toddlers, you know, my girls are exactly 2 years and 5 days apart. Boy, they're a handful when they're really little. They're still a handful because kids are kids and they require your full, complete, undivided attention. But when my kids were really little, they were very busy, and I didn't really have time to focus on not feeling well because I wanted to make sure that nobody was, you know, pulling knives out of the knife block. Nobody was climbing the bookshelf and having books fall and topple on top of them. That nobody was, you know, eating the dog's food. Like all of those things that you have to watch little kids for, I was watching little kids for, and I really didn't have time to focus on my own situation and my own pain, and that was good. I also realized that once they got to be a little bit older, and my oldest, who was 5 at the time, started school, I was like, you know what? I think I can go back to work full-time. So I went back to work full-time. I had a 3-year-old and a 5-year-old, and after 2 years of working full-time and being in constant pain and kind of ignoring it, my body quit working. Something happens, and a switch flipped for me, and I refused to go see any more doctors. I didn't want to talk about my pain. I just wanted to pretend that it wasn't happening. And for years, I didn't see anyone. I didn't talk to anyone. By, 2012, 2013, I got to the point where I was asleep for 16 hours a day. I'd go to work, and I'd get off work at 6 and I'd pick my kids up, and by 6:15 my head would hit the pillow and I would sleep until the next morning when I had to get up and get ready for work. And I'd be to work by 9:30 in the morning and then work until 6, pick up my kids and collapse in bed. And the weekends I would spend all day Saturday and all day Sunday sleeping. I had a realization while I was spending all that time in bed is that I was not going to get better. And I finally came to terms with the fact that that's what the rest of my life was going to look like. I wasn't going to really see my kids. I really wasn't going to spend time with my husband. I wasn't really going to do anything anymore. And then a couple years later, my body physically gave out. I ended up being diagnosed as adrenal insufficient. I wear an emergency alert bracelet for that. It's kind of a big and serious thing. So I'm laying in bed and I'm realizing my life is never going to get better. This is going to be it. My kids aren't going to be raised by me. They're going to be raised by Nanny Netflix. That's what I dubbed Netflix, because I would put my 3 and 5-year-old in front of the, screen, and I'd leave my bedroom door open so I could hear them. And if I heard them, opening cupboard doors, what are you doing? If they wanted me to read a book, they'd have to bring it to me in bed, and I would do stuff like that. But I really didn't do anything for them. I was in bed, and then I would go to work. And then when I couldn't work anymore, I was in bed. And then I would go pick them up from school and then fall right back in bed. And they spent so many years, and I was here in the house with them, and they could wake me up if they needed to, but they were on their own, and they were really little. And at the tail end of 2016, I'd been diagnosed as PTSD from all the physical pain I'd been in, and doctors telling me that either there was nothing anatomically wrong or there was nothing that they could do, and I just have to deal with it. And all of the times I had a medication work and then stop working, and then work and then stop working, and then work and then stop working. And I got to the point where I was sure I was never going to walk into another doctor's office, that I was never going to tell anybody else about the pain that I dealt with, that I was just going to be a hermit in the 4 walls of the bedroom that I'm in right now. And my husband, dear man that he is, he asked me, he says, I know going to a doctor is very stressful and it puts you in a bad place, in a bad state of mental health. He says, but I never see you anymore, and the girls don't know you at all. Would you be willing to see just one more doctor? And I told him, no, I can't. I physically can't. I can't bring myself to go here. I can't help you. There's nothing we can do. I'm so sorry. This is your life. I said, I already know this is my life and nobody's been able to help me. And I've seen almost a dozen people. He's like, just one more. So I called my primary care physician and he made a recommendation. And it was probably the best thing I'd ever done up to that point in my life. He recommended that I see somebody at Swedish hospital in Seattle. And it started out by making a recommendation that I see a headache specialist there. And I live 5 hours away from Seattle. So I drive 5 hours one way to see specialists there and then drive home all in the same day. It's 10 hours of driving, well, like 9.5 hours of driving depending on traffic. And for somebody who's chronically exhausted, that was really, really hard to do. And I started seeing the headache specialist, and she did a lot of stuff my local neurologist had done and basically said, well, we've tried everything I can think of. I can't help you. Let me recommend you to a neuropain specialist who did a lot of tests and a lot of injections and this, that, and the other with my nerves. And he basically said, well, I can't help you, but let me have you see. And he referred me to a neuro-ophthalmologist. And the neuro-ophthalmologist was not just looking at my eyes and my optic nerves. He was also looking at intracranial pressure. And they discovered something that they hadn't figured out before, that no other doctor, those 11 other doctors had never done anything like this. So he said, you know what? I think you need to see the neurosurgeon, this vascular neurosurgeon. So I went to go see this amazing physician. And after seeing 4 specialists, he says, let's just do this one test. Have you ever had one of these before? I was like, I've had a ton of MRIs. He's like, it's not just an MRI. It's a cine flow study. Let's see what your intracranial pressure is like. And it turned out my intracranial pressure was so high, their equipment couldn't actually quantify it. They said they'd never seen intracranial pressure that high. They were like, I've never seen numbers like this. We don't have any other patients like this. I don't know what's happening. And he says, you know what? You've got a serious blockage here. And the truth was, the part of my brain, like right back here, had adhered itself, the cerebellum had adhered itself to the dura. The dura is the kind of membrane, the covering to the brain that keeps all the spinal fluid in. And those two things had fused together, and they're not supposed to be fused together because spinal fluid is supposed to be able to flow all around there. There's no nerves in your brain, but there are a multitude of nerves in that membrane, the dura, the covering to the brain. And every time I was moving, that was getting pulled and shifted, and it was causing extreme pain. And nobody figured it out until this guy. And I was like, so what do we do? And by that point, I started seeing specialists in Seattle in January, and by that point, it was August. One of the terrible side effects of spending 6 years in bed, 14 to 16 hours a day, is that you don't exercise and you gain a lot of weight. And he's like, we probably should do surgery, but I'd like you to lose some weight beforehand. And I was like, you're saying that you want me to spend a year or more losing weight before you're willing to do this surgery? He says, it's high risk. I said, I don't care. I need to be pain-free now. I'd been in so much pain for 12 years at that point. Go to sleep with a headache, wake up with a headache. Go to sleep with a headache, wake up with a headache. And an extreme headache that was ruining my life. And he finally said, okay, if you're willing to sign the waivers, I will do the surgery. So he did. I remember hearing after the fact, my husband got a phone call while they were in the surgery suite. And my mom and dad, who are both medical professionals, my dad's a doctor, an anesthesiologist, and my mom is a nurse. They both said you never want to get a call while the patient is still in surgery because it's 90% of the time it's bad news. And when they got a call and I was still in surgery, thankfully it was the neurosurgeon calling to let my husband know. My parents were there, my brother was there, and his wife, that they had found this complication and that it was going to take more time to separate the dura from the cerebellum. They had logged 4 hours for the surgery, and it turned out to be a nearly 6-hour surgery, 5.5 hours, I think, almost 6 hours. And they had to very carefully use a blade and separate the brain without cutting into the tissue from the dura, which is a really thin membrane. It was a lot. It was extensive. I don't understand how they did it. They fixed me up, and when I woke up later in ICU, I felt so good, and it was the first time I didn't have that extreme headache. So I got discharged 5 days later. I was recovering well. I started finding I had a little bit of a spinal fluid leak. Spinal fluid was coming out and getting stuck between the tissue of the muscle tissue. I had a big kind of squishy spot in the back of my head, but that had happened the first time I'd had this surgery. I went to see my neurosurgeon. He says, okay, if you start finding spinal fluid, like the back of your head is sticky or crunchy, if you start finding wet patches on your pillowcase, he says, change your pillowcase every night. He says, because if fluid is getting out, bacteria can get in. And guess what? I started finding spots on my pillowcase, fluid got out, bacteria got in, but I didn't know it until it almost killed me. I got an infection. And by the time we discovered that I had bacterial meningitis, the back of my head had ruptured and become an opened, gaping wound. And I was here in my small town in Washington State, and they had to life flight me back to Seattle. So they put me on an airplane. I didn't know how close to dying I was, and that's okay. But my husband was driving like a madman that 4.5, 5 hour trek, depending on traffic, from our small town to Seattle, hoping the whole time and praying that I made it. And I was in so much pain that I didn't even think about that. All I could think of was, please make the stop, please make the stop, give me something to kill the pain. And they were giving me remarkable amounts of really heavy duty narcotics, and nothing was touching the pain. So the next morning, I got in at 10 o'clock at night. The next morning they took me in to reopen this back area, to take out all the pus, to take out all of the tissue that was unhappy, and to close it all up. So they did an incision and drainage. So they were able to get out all of the infection. And an infection near your brain can kill you. Didn't know how bad it was. Anyway, 2 days later, I'm still in the neuro ICU, and I'm still having remarkably terrible headaches that are not going away. And that's when they decide to put in a VP shunt, or a ventricular peritoneal shunt. So I have a little device right here. It's like a little lump. It's like I don't know, it's about this long, and it's right here. And it's kind of, they made a burr hole, so like a little hole in my skull, and they put this little cone-shaped device down into my brain, and the very tail end of it is in one of the ventricles. And so when my brain makes too much spinal fluid and there gets to be too high intracranial pressure like I had before, this little pump kicks on, and it drains out through a piece of tubing that gets connected to this, comes all the way down behind my ear, down my neck. You can probably see it like right in through here. Goes down between my breasts and snakes around in my abdomen and ends close to my appendix. And so when there's too much intracranial pressure, this drains it all. And that was fine. So that was surgery number 4. And when I recovered from all of that, and I took weeks and weeks of antibiotics, and they were like IV antibiotics that I had for 3 weeks after I left the hospital. It was drama. It was terrible. I'm glad I'm still alive. But the next year, like all of December of 2017, all of 2018, I didn't have any headaches. And then at the beginning of 2019, in January, I got my first headache again, right back where it had been really bad before. And I ignored it because 3 days later it went away and I was up and fine. I was like, okay, occasional headache. I had 3 days in bed. That's not bad. I used to live in bed. In February, it was 5 days. And by April, it was 10 days. A third of the month, I was laid up in bed with the worst headache. And that's when I realized my body wasn't used to being in pain anymore. And I started getting worried that I was headed back to the place that I had been before. And so I instantly called my neurologist here in town, and he did some injections, and those didn't help. And then I started getting really stressed about the idea of seeing more doctors and maybe hearing again that there's nothing we can do to help you. That sadly, we've opened that part of your head up too many times. If we open it again, we're not sure what's going to happen. It's just going to create more scar tissue. Your headaches are just going to get worse. I was so afraid of what I didn't know that I became paralyzed, and I couldn't call, couldn't make an appointment. I didn't tell anybody about it. My husband knew I was in pain, but he didn't know how bad it was. And then on July 29, my headache came back, and it hasn't gone away since. And every single day from the 29th of July, I've gone to bed and I've woken up with a headache, and I've gone to bed and I've woken up with a headache. And my fear again is that I will end up in bed like I did before, but only this time there won't be a solution. That this is the rest of my life. So I've been ignoring it and putting it off because in September I had gallbladder surgery, which turned into a huge debacle. I even had an appointment with my surgeon today who did my gallbladder removal. I've had so many CTs of my abdomen, so many complications. One simple outpatient gallbladder removal turned into 4 surgeries, a 5-day hospital stay, 8 CTs, 4 ER visits. Like, when something wrong happens, it's always to me. Anyway, so that took up a lot of my time this fall, and I kind of put my headaches on the back burner. And then in November, I'd had a complete, resolution to my gallbladder drama. And my husband finally said, how's your head doing? Dry my tears with my little sponge here. And I was like, pretty terrible. And he's like, have you called your surgeon in Seattle? And I was like, what surgeon in Seattle? No. He's like, you're spending a lot more time in bed. He says, I'm not worried how you spend your time, but I know that when you get to that point, you're in a lot of pain. And you're spending less time on the weekends with us as a family. Like, we want to go to a movie, you stay home and sleep, and I take the girls. We want to go down to the patisserie and, have a pastry and a cup of coffee, and you stay in bed and I take the kids. And he says, and I don't mind doing that with the kids. He says, but I'm worried that we're falling back into that place that we were years ago. And I told him, I said, I don't think I have the strength to do it. So he helped me make a phone call, and I saw my neurosurgeon in Seattle on the 5th of December. I had a CT done. I had a series of x-rays done, which showed that the ventricles in my brain, there are 4 ventricles. That's where your spinal fluid is made. Because I have this little device that goes straight down in there and sucks out when there's too much. It'd been taking out more than it needed to. And so I had what they call slit ventricles, where each of these little places that there's 4 ventricles, I think I already said that, they're like little balloons full of spinal fluid. But when you have a shunt, it drains all of that. And instead of being like this, they kind of collapse. And the walls, instead of, being a space like this, the walls touch each other. The brain's like, look, I have more space. I'm going to take up more space. And then it's very difficult to get those ventricles full again. Your brain's kind of like, nope, I got all the elbow room in here. No more for the spinal fluid. And some people have pain from that. And some people live normally and fine all the time. So they changed the setting on my shunt, hoping that would help my headache. It hasn't. It's been 2 weeks and it's still the same. The other thing they've done is they've ordered another MRI, a city flow study, which will check the intracranial pressure in my head. And that's the test that when he did it last time, they discovered that they needed to do another surgery. And even thinking about this, I don't know which is worse. You have to have surgery again, or there's nothing I can do for you. And I'm so sorry, but you're going to have to live with this for the rest of your life. And the fact that I'm almost 45, midlife is not the time that you want to get the diagnosis of, I'm so sorry, I can't do anything for you. So I've been dealing with this emotionally. I've been trying not to freak out my family, so I don't talk about it in front of my children. My husband hears a lot about it. My parents are very worried about me. I try not to worry them too much. But I've kind of just been unable to sleep, obsessing about this. And I'm one of those people that the minute I know this is my problem, I fall down the rabbit hole of too much information. And I'm not talking like WebMD. I'm talking like articles written by doctors for doctors, and watching YouTube videos of doctors at conferences speaking to other doctors about this specific problem. And I've learned a ton of stuff, and knowledge is amazing for me. So the more I know, the better informed I am, the better I feel like it gives me a little bit of control. Not that I'm doing anything, but I feel informed enough when people speak to me. I don't need to have it dumbed down because I kind of understand the playing field a little bit more than the average person. And I feel like that sort of educating myself has been very helpful to me, just for my mental health. But that's kind of what I'm dealing with. And here's hoping I don't have to have any more surgery. And then here's hoping that I do, because it might take care of my pain again. So I don't know if I'm going to need some time off, whether it's for my mental health or whether it's because they need to do more surgery, or I'm traveling to Seattle all the time to get a different type of treatment that's not surgical. So I may need to slow down. Instead of 3 videos a week, it may slow down to 1. I may take an unspecified amount of time off. But I wanted to let you know what was going on. And if you've made it all the way to this point in the video, thank you so much. I really appreciate YouTube so much as a space, because YouTube is really what got me through those 6 years of being in bed for so long. If I was awake, I'd watch a video. If I was awake, I'd watch a review about something. And it really was a wonderful place where even though I wasn't an active part of the community by like making comments, I saw other people creating a space where like-minded people could come together. And that's why I love doing YouTube. It's not for the viewers. It's not for anything other than I feel like I get to have a place to talk to people who love the same sorts of things I do. So YouTube will always be important to me, but I don't know what's going to happen in the near future with my channel. I'll let you know. I might just slow down things a little bit. But that's kind of where I'm at. Here's hoping I have the heart to edit and upload this video. But thank you so much for watching today. Thank you for being interested in me and how I'm doing, because if you're watching this, you obviously are. But I want you to know that I appreciate you so much, and that I hope that there's an easy, not too painful, non-surgical solution to my problem, so I can go back to being the active person in my family's life, and can finally go and get a job and still have time to do YouTube, because it's what really, really delights my soul. Thanks for watching. Have a fantastic day. I'll see you again soon. Bye.